What's your game plan for a winning smile? We're going to pitch you some great ideas that are sure to be a hit. We've called up dentist Steve Marsh from his office dugout to play ball with us on this topic today. Thank you very much for coming, Steve. And you're a big baseball fan. That's something that I've known for a long time. You're there. You go to the Indians training camp and home opener. You were just there, and we've got a super fan as well as a super dentist. What's your lineup for viewers who want to hit a home run with their smile?
You certainly have used the baseball metaphor. In fact, recently I was just at spring training, as you mentioned, and combined that actually with a dental course out in Phoenix and got to see the Indians. But beyond that, when you go to spring training, you see the team is looking at new players and that sort of thing. They're evaluating who can play what position, whether some are worth keeping and some go to the minors. Well, when we meet patients the first time and when we've established a relationship and they want me to do either a makeover or just see what they can keep and what isn't good, we do a very thorough evaluation from x-rays to models, that sort of thing. So that, like the Indians, we see who's worth it to keep, who isn't, and what we can do to improve their game. And that's really what we're talking about in dentistry.
All right, so you see how the teeth play in their different positions. I'm going to keep going with this analogy as long as I can. Well, then what?
Well, then we have to actually make a game plan, very much like the Indians do. Where are we going to play them, as I said. And what we do with dentistry is today we'll take photographs, and we do a very good job at evaluating what they have. We need to know what the patient needs as well as what we need. I'll actually invite patients to draw on the photograph. The other thing is we do prototypes, Armand. The Indians may look at a chart to see where they're going to play different people. We actually do it with models, and this is a patient where we took a model. She had a very wide space, and then we did a wax prototype to show the patient what we thought they could achieve in dentistry. And so, like the Indians make a plan, we make a plan. The prototypes work, Armand, and they work whether you're doing one tooth, two, or a whole mouthful. It's very important for your viewers to know that regardless of the amount of work a dentist can do, you really need to do your due diligence and plan it out before they actually get started.
All right, so now I want you to go to some examples of patients that have run the dental bases, if you will, and scored a big smile.
All right, I'd be glad to.
Okay.
It's interesting, your last patient was, not patient, but your last guest talked about retirement. And this is a patient who's a teacher who was approaching retirement. And so she also wanted to maximize her dental insurance, if you will, and had some problems. And before we ever did her teeth, we did these photos and then we did some models. She liked what we put together, and the after picture shows what we did with porcelain veneers. We removed some of her older crowns that had decay or leakage, if you will, and that gave her a beautiful smile. She was able to use it over 2 years, and that's how we were able to maximize her insurance as well. This patient had a lot of dentistry done. She's in her 70s over the years. She came to me, and one of the things that's important is how long does it take? She spends part of her year in Florida, so she said, listen, I have a few months, can you do it? And again, we did a prototype, put our ideas together. We removed those upper front crowns and put all porcelain crowns. That's one of the things that we're able to do. And again, she would spend a lot of time with me looking at colors and shades and shapes, so that we went into this restoration knowing exactly what she wanted to achieve.
All right, can you do one more?
One, maybe even another if I can. This patient came in, she's in sales, and never liked the way her smile looked. The teeth had rotated over the years, she had lost one tooth, and just didn't give her a very pretty smile. A very outgoing person, but she said when she met people, she didn't always smile the way she would like. She was ashamed of it, even with pictures. So we ended up doing these with porcelain veneers, reshaped the lowers. Doing 8 or 10 teeth gave her this absolutely beautiful smile.
Sounds great, Steve. Always great information, and the pictures were amazing.
Well, we again, it's part of being a team, as you had suggested at the beginning of this introduction.
All right, it's your turn up to bat. If you want to take a swing at getting a new smile and you want to make sure you hit it out of the park, give the dentist who's always on the ball a call. Steve's number's next.
See what Dr. Marsh can do for your smile by calling 440-461-1003 or visit www.clevelandsmiles.com.